Today, we're tackling a really vital topic. It's about the changing climate, and specifically, how it impacts the health of children.
Our main source is a very important new policy brief from Save the Children. It's called Prioritizing Children's Health Amidst the Climate Crisis.
Right, and this brief is actually being used right now as part of a peer learning course. That's something developed by Save the Children and the Geneva Learning Foundation.
Yes, a space really designed for people like you, health workers, to connect, learn from each other, and share what you're seeing on the ground.
So our goal for this deep dive is pretty straightforward. We want to walk you through the main ideas in this brief.
Help you understand the big picture. How this huge issue of climate change connects directly to the health work you're doing every single day.
Exactly. Because climate change can feel overwhelming, like this massive global thing.
But this brief really cuts to the heart of it. It affects everyone, sure, but the science is clear. It hits children the hardest.
So let's start there. Why children? What makes them uniquely vulnerable?
Well, it's fundamental, really. Their bodies, their minds, their immune systems, they're all still developing. They're just biologically more sensitive to environmental threats than adults are.
Okay, that makes sense. Developing systems are more easily disrupted.
Precisely. And the brief uses some pretty stark data to show what this means for children born today.
Ah, yes, the comparison. A child born recently, say 2020, versus someone born back in 1960. What does that look like?
It's quite alarming, actually. The brief states a child born in 2020 will likely face, on average around the world, twice as many wildfires in their lifetime.
Twice as many. Wow. And it's not just fires, is it?
No, not at all. The brief projects 2.8 times more crop failures. Think about what that means for food and nutrition.
A direct hit on food security.
Absolutely.
Yeah.
And then you have 2.6 times more droughts.
Affecting water.
And 2.8 times more river floods. Think about displacement, waterborne diseases.
Okay, so across the board, more extreme events.
But the heat wave number is maybe the most staggering. The brief says a child born in 2020 is projected to face 6.8 times more heat waves.
It's quote 8 times. That's huge. It really shows this isn't some distant future problem.
No, it's the reality for the children you might be seeing in your clinic today. Their childhood climate is fundamentally different.
And these extreme events, they have direct health impacts, right? Let's talk about heat first.
Yes. Young children, especially infants, they just can't regulate their body temperature as well as adults. It's a physiological difference.
Making them much more vulnerable to things like heat exhaustion.
And heat stroke, which can be deadly. The brief also points out that extreme heat during pregnancy can cause serious problems.
Like preterm birth.
Exactly, and low birth weight. So the impacts start even before the child is born.
Okay, beyond the direct heat, what about diseases?
Well, the changing climate creates better conditions for certain diseases to spread. We're talking about vector-borne diseases, those carried by insects.
Like malaria, dengue.
Precisely. Huge problems already, and climate change can make them worse, expand their range.
And what about things like diarrhea?
Yes, the brief highlights that too. Climate change impacts water safety and food safety, leading to more diarrheal diseases, more cholera. These are illnesses you likely deal with constantly.
And the brief links climate change to making them more common, harder to control.
That's the connection it makes, yes. A significant contributing factor.
Another major impact area mentioned is nutrition. You touched on crop failure.
Right. Climate change hits agriculture, hard droughts, floods, unpredictable weather. This means less food, more expensive food, sometimes food that's less nutritious.
And the brief has some worrying projections there, too.
It does. It estimates that by 2050, climate change could mean an extra 40 million children are stunted too short for their age due to chronic malnutrition.
40 million stunted. And wasting.
And potentially 28 million more suffering from wasting dangerously thin. These are severe forms of malnutrition.
With lifelong consequences. And we know malnutrition weakens children so much.
It's a devastating cycle. The brief reminds us of a really sobering fact. About half of all deaths in children under 5 are linked in some way to malnutrition.
So climate change impacting food security directly fuels this vulnerability, makes children more likely to die from common illnesses.
That's the clear link the brief draws. Malnourished children simply don't have the strength to fight off infections, including those made worse by climate change.
The brief also talks about mental health, which is so important.
Yes, definitely. Experiencing climate disasters, floods, storms, losing your home, or even just the anxiety about a changing future, it causes huge distress for children.
And it can make existing mental health issues worse.
Absolutely. There's a quote in the brief from a 17-year-old Alvaro Chile.
What did he say?
He points out that the effects aren't just material damage, he says. Often they are mental. Therefore, it is also important that there is psychosocial support, which is often not considered.
That's such a crucial point. The unseen impacts, the need for support after disasters.
It really underscores a key idea in the brief. Climate change acts as a threat multiplier.
A threat multiplier. What does that mean exactly?
It means it doesn't just create new problems out of thin air. It takes existing challenges, poverty, displacement, living with a disability, and makes them much, much worse for children already facing those situations.
Right. So if a child is already struggling.
Climate change adds another heavy layer of risk. The brief gives the example of urban children in slums or informal settlements.
Okay.
1 in 4 urban children globally live in places often lacking safe water, sanitation, decent housing. Climate impacts like heat waves or floods make those dangerous conditions even more precarious for them.
And the brief also notes that women and mothers are disproportionately affected too.
It does, yes. They often carry the burden of care and finding resources, especially in vulnerable communities, making them particularly exposed to climate stresses.
Okay, so we've seen how climate change hits children's health directly, heat, disease, nutrition, mental health, and how it multiplies existing threats.
But the brief takes it a step further. It asks, what about the health systems themselves? The services children rely on.
So how does climate change affect, say, your clinic, your ability to actually deliver care?
Exactly. This is where it connects very directly to your day-to-day work. The brief explains it makes things harder in a couple of key ways. First, demand goes up.
More sick kids needing care.
Yes. More climate-related illnesses mean more strain on already stretched services.
Okay, increased demand. What else?
At the same time, the ability of the health system to respond gets weaker. Think about extreme weather.
Floods damaging clinics, storms blocking roads.
Precisely. Clinics might be damaged or inaccessible. Health workers might not be able to get to work. Patients might not be able to reach the clinic.
And what about supplies? Medicines, vaccines.
Huge issue. If roads are washed out or infrastructure is damaged, delivery chains break down. You can't get vaccines, medicines, or nutrition supplies through.
Imagine trying to run an immunization clinic if the vaccines didn't arrive, or the fridge isn't working because of power cuts after a storm.
It makes providing those essential life-saving services, immunization, nutrition support, water OSH, water, sanitation, hygiene, incredibly difficult, sometimes impossible.
The brief also mentions displacement, right? Climate crises forcing people from their homes.
Yes. Droughts, floods, major storms can force families to move. This obviously impacts their health directly, but it also puts immense pressure on health services in the areas where people arrive seeking safety.
Straining resources even further.
Exactly. There's a quote reflecting this from Dr. Abdelmajid Abderrahim, the Minister of Public Health in Chad.
What's his perspective?
He basically says that in a place like Chad, where climate change and displacement already make delivering health services very challenging, things like vaccines become absolutely critical tools to manage outbreaks and save lives.
It really highlights how vital those core health services are, especially when everything else is under stress.
It does. And you, listening, you probably recognize these challenges. Maybe more children coming in with certain illnesses, maybe difficulties reaching remote communities, or struggles getting consistent supplies.
The brief makes it clear. Climate change isn't just another problem to add to the list. It's fundamentally challenging the ability of health systems to function.
So the brief lays out the problem very clearly. But it is a policy brief, so it doesn't stop there. It calls for action.
Right, it makes recommendations. Who are they aimed at?
Lots of different groups. Governments, international organizations, health bodies, civil society, and importantly, it stresses involving children and communities themselves.
Okay. For someone working in health, like our listeners, what are the key actions the brief calls for?
One really big one is about money, finance.
Okay.
The brief is very direct. There is nowhere near enough funding going towards health projects specifically designed to help communities adapt to climate change impacts.
It gives numbers on that, doesn't it?
It does. The estimated need globally for this kind of health adaptation funding is around $11 billion per year.
$11 billion needed. And how much is actually going in?
Less than $150 million per year on average between 2009 and 2019 for specific health projects. It's a huge, huge gap.
Wow. Less than 2% of what's estimated to be needed.
Exactly. And the brief argues this funding needs to be easier to access, and critically, it should be mostly grants, not loans.
Why grants specifically?
Because climate disasters often hit the most vulnerable countries hardest. Taking on more debt to recover just makes things worse in the long run. The brief mentions Pakistan after the 2022 floods.
What happened there?
The health sector suffered huge financial losses, estimated at $143 million, disrupting services for millions. More debt wouldn't help that situation. Money is needed to build resilience without adding to the debt burden.
Okay, so more money, better money. What else?
Strengthening the health systems themselves. The brief uses the term climate resilient and low carbon health systems.
That sounds a bit technical. What does it mean in practice?
Well, climate resilient basically means making sure health facilities, supply chains, the whole system can keep functioning even during extreme weather.
So like reinforcing clinic buildings.
Yes.
Having backup power.
Yes, things like that. But also training health workers to recognize and manage climate-sensitive diseases, making sure supply routes are adaptable, having early warning systems for outbreaks linked to weather.
Making the system robust against climate shocks and low carbon.
That's about reducing healthcare's own contribution to climate change. Health systems use a lot of energy, generate waste.
So using solar power for clinics instead of diesel generators. Better waste management.
Exactly, making healthcare greener. The World Health Organization actually has a framework to guide countries on building these kinds of stronger, cleaner systems.
Another key point in the brief is about working together, right? Across different sectors.
Yes, collaboration is crucial. Climate change impacts health. But the causes and solutions often lie in other areas: water, agriculture, environment, energy, infrastructure.
So health workers and ministries need to connect with people in those other departments.
Absolutely. To find solutions that work across the board. You can't solve climate-related health problems just within the health sector alone. It needs joined-up thinking.
Makes sense. And what about involving people directly?
That's a huge emphasis in the brief. Listen to children and communities. They argue it's absolutely vital.
Why?
Because people living through the impacts know best what's happening on the ground, what the local needs are, what solutions might actually work in their context. Their knowledge is essential for effective planning.
The brief includes quotes on this, I think.
Yes, powerful ones. Dia, who's 16 from Bangladesh, says, "Please listen to us and give additional importance to our voice. We promise you to become part of the solution."
Part of the solution, that's great.
And an 18-year-old boy from South Africa puts it very directly. "We are going to be the ones suffering from the climate crisis, so policymakers should include us. Nothing about us without us."
Nothing about us without us.
Yeah.
A strong call for participation.
And the brief reminds us this isn't just a nice idea, it's actually a child's right under the UN Convention on the Rights of the Child to participate in decisions that affect them.
Okay, one last action point.
Better information, better data.
Meaning?
We need to collect much more specific data broken down by age, gender, disability, location, to really understand who is being affected by climate change and how. Right now, a lot of that detailed information is missing.
And without that data, it's hard to target help effectively.
Exactly. Good data leads to better planning and better outcomes.
So the big calls are more and better finance, stronger health systems, resilient and low carbon, working together across sectors, listening to kids and communities, and getting better data. Does the brief show any examples of this happening?
It does. It highlights a project in Laos, which is significant because it's the first health project funded by the Big Green Climate Fund. Save the Children is involved there.
What are they doing in Laos?
It's a great example of building resilience. They're strengthening health clinics to cope better with heat and floods, physically upgrading them.
Okay.
They're also improving early warning systems for climate-sensitive diseases like dengue and diarrhea, training health workers on climate and health issues, and improving water and sanitation in communities.
So really putting those ideas of resilience into practice on the ground.
Exactly. It's a tangible example of building a more climate-resilient health system, focusing on the local level, close to the people affected.
And it mentions Sierra Leone, too, briefly.
Yes, as another example of supporting local communities to tackle climate impacts directly. It reinforces that action needs to happen right there at the community level.
These examples show it is possible then. Steps are being taken.
Absolutely. Tangible steps to build the kind of resilience children need.
Okay. So as we start to wrap up this deep dive, let's just bring it all together for you, our listener.
This Save the Children brief paints a really clear picture. The climate crisis is a child health crisis. It's making kids sick, and it's making it harder for health systems for you to provide care.
But it's not just doom and gloom. It also offers a way forward. It outlines concrete actions needed from the global level right down to your community, your health facility.
And your role in this is critical. As a health worker, you are on the front lines. You see the impacts firsthand, perhaps every day.
Your experience, your knowledge of what's happening locally, that's incredibly valuable information.
The core message, really, is that protecting children's health in this changing climate needs everyone pulling together. Needs big international agreements, yes, but it absolutely needs action and adaptation right where you are.
And this deep dive, the peer learning course,
Yeah.
it's all about supporting that, helping you connect, share what you know, learn what works.
There's a final quote in the brief from Nafiso, a 17-year-old in Somalia. It's very powerful.
What does she say?
She says, climate change is not a distant threat. It's about saving lives. Listen to us, act for us, and secure a safe and healthy planet for all children.
It's about saving lives. That really brings it home.
It cuts through all the policy language, doesn't it? It's about children right now.
So maybe a final thought for you to take away from this. The brief clearly shows that solving this needs everyone, including health workers like you. You're seeing the effects, working within the system.
So the question is, how can what you see, what you do every day, how can that knowledge help build a healthier future for children in your community, even with the challenges of a changing climate?
Your insights from the front lines are really essential to figuring out the best way forward.
Thank you so much for joining us for this deep dive into the Save the Children brief.
We really hope it's been useful. Please do continue exploring this vital topic and connecting with your peers to share ideas and find solutions together.